morning. This is Dr. Santucci from Advanced Regen Medical. Today I want to talk about the effect of autoimmune disease and the triggers for autoimmune disease, and really how it affects what we're looking at in our clinic. So we did chronic acute care for 20 years, and one of the things that we noticed is that people would kind of have this concept that things were coming from nowhere, that it just happened. Well, we don't really think things just happen, especially when there's huge increases in the numbers of autoimmune disease or complex acute conditions that seemingly are idiopathic. One of the things we've trained ourselves to do in advanced diagnostics is that whenever anything is considered idiopathic, we cross it off and immediately consider autoimmune. So we put together a chart that basically summarizes the autoimmune conditions that we've been looking at. And in the day, it was thyroid disease. Thyroid disease was the first grand non-diagnosed disease. So we know that the reference ranges that were being used were too liberal. So when you're looking at TSH of 0.5 to 5.5, that's too much. And then basically they said we don't know where it comes from. Well, we began to develop theories on where it came from. And so when you get these multi-100% changes in autoimmune disease, you've got to consider autoimmunity. That isn't suddenly our species changed, it's our environment changed. And so one of the things that we began to see, we were running brain scans on people, and the people with thyroid disease also had aberrant brain waves, and that their brain scans weren't coming out very good. So there was this interrelationship. And so one of the things that medicine does very well is it says that this condition is related to this condition. One of the things that isn't done very well at all is to say what the underlying cause. So when you develop a map like this, you begin to say, wait a minute, it looks like this is a family of autoimmune diseases, and the thing that joins them together is that they have similar triggers. So now we run a stem cell clinic. We're doing a lot of orthopedics, we're doing a lot of peripheral neuropathy. So we get people with really bad arthritis, and it just came. So one of the things that is almost never true is that it's not because of your age. We have 80-year-olds that don't have any of this stuff, and there's a theme in it. So when we're looking at rheumatoid arthritis, looking at peripheral neuropathy, looking at digestive issues, looking at skin issues, looking at things that basically look like they came from nowhere, what we want to do is to take a step back and say, where did they possibly come from? So about 20 years ago, the United States began to morph the genetic structure of wheat, so the so-called Gmo wheat. So the first level of the Gmo wheat, they took 11 grains on a stalk and made it 22 grains. After that, they made it so that it was stored a little bit better. Cereal grains are stored for a couple of years in general. So they made it so that they didn't break down. Well, breaking down is the process of digestion. So it formed, we had twice as much wheat of undigestible grains. The next level actually created brain cancer in the lab rats that they were testing it on. So we went further and further and further from a natural substance. When your primary grain changes your DNA, so when we're thinking about genetics, we actually like the word epigenetic. The food that you eat influences the genes that you have, and then they manifest in different conditions. So these have exponential increases over the last 20 years. So especially someone in the 60, 70, 80-year-old range is going to go, no, wheat is good, I've had it all my life. And that's true, but it's not good as of the last 20 years. And unfortunately, the last 20 years is when they began to get old. So they blamed it on, numbers of years on Earth. And what we actually know is that it's an autoimmune trigger. So when we began to look at these families, I made this chart about 8 years ago, woke up in the middle of the night, and I said, how come my thyroid patients have trouble with their brain waves? How come that, there's this multiple autoimmune syndrome going on? And what we began to realize is that there were environmental factors, and we're going to start with food. So it's gluten and dairy as the food antigens, After that is metals. So, if you've ever worked in a heavy metal shop or a semi-metal chip factory, or you just have a hobby that uses metals, if any metals got into your system, into your bloodstream, they are now in your brain and in your fat and in your bones. So testing for metals has turned out to be a very, very productive thing. The testing for the foods is the antibodies. So we're not talking about allergies here. We're not talking about IgE. We're talking about secretory IgA autoimmune markers. So when we actually test for that, we get a much, much, much deeper answer. The insidious thing about all this is you can have it and not know you have it. So one of the things that we're really encouraging people to do is to kind of scratch out the it's aging or it's normal to it's common and it's not normal and it's something you can do something about. So the very first thing we encourage most patients to do is to get the testing for the gluten and dairy, egg and soy, and that's a HLA-DQ-B1 gene test. That actually will give you the real answers for your genetic type and for you specifically. What we have seen is we've done about 500 of these and about 498 of them came back positive. So we don't think there's very many people that can eat the new Gmo wheat. Dairy is a second runner, so the casein protein has the same secretory IgA, little less strong, but to certain respiratory conditions and people with problems with breathing, they're going to want to focus on that. Less is, it goes gluten, dairy, egg, yeast, soy. So, it goes down in terms of the antibody response. And these responses are in the villi of your small intestines. They're kind of coded for these different foods. And so what we can do is eliminate those foods and we eliminate an underlying cause. So when we go down this list, these are the things you can do something about. So we like the fact we can diagnose it. We like the fact that we can have a clinical impression, but we really like the fact that we can do something about it. So in many cases with peripheral neuropathy, in addition to balancing out blood sugar and getting a person exercising and getting their physical body working, we're going to look at the autoimmune system and balance out the natural killer cells with the autoimmune reaction, the antibodies, and eliminate these triggers as much as we can. In very serious cases, like cancer cases, we would just come right in and stop gluten and dairy and then go down the list. So these are the main triggers. When we first made this list, we had 22 different triggers. We're basically addressing this in most people with these 6 or 7 items. And so gluten, dairy, egg, yeast, soy, heavy metals. And the heavy metals, we can actually test for. It's a urine test. It costs a couple $100. And basically it can show you if something in your lifetime has basically gone into your cellular structure and is influencing oxygen, cellular reproduction, energy in general. Stress we kind of laugh about in the Silicon Valley. If you're working here and you're living here, you have stress. We have every kind of stress there is. People move back to New York to have calmer lives. So we understand that DHEA cortisol as sterile hormones can basically influence your brain to influence the inflammatory pathways and set this whole cycle up. So hormones, it's still the great frontier. You'd think that after all this time with the female hormone testing and the amount of research there's been into birth control and different things like that, we'd have a better handle on hormones, but it's not really done very well. So with hormones, we want the patient to get probably the Dutch testing, the more elaborate testing, and then look at a biased, triased kind of individualized hormone response. Beyond that, pesticides, poisons, and then trauma. In general, people go through things, they break bones, they have sprained strains, they change their basic structure, a lot of form and function kind of problems, and then they just ignore them. Well, your body doesn't ignore it sometimes. So, I've been over a dozen high-speed car accidents. Eventually, that takes a toll. I ended up with 2 autoimmune diseases that were seemingly unrelated, but they were definitely from the trauma. So when we look at charts like this, there's not very much, that we can't begin to identify as relating to this. There is not good conventional science on this because frankly no one would benefit. There's no money to be made for proving this point. clinically, it's incredibly useful. So for you, what we're encouraging you to do is to say, where did the thing you have come from, really? Sure, what can we do about it today? But what's the underlying cause? What is it that you can do? And, probably with some direction and some investigation to address your autoimmune issues.